Mary, I don't know how you want to do it, whether you would like Fiona to speak first or whether you would like to speak first, or since we're in your hands.
And then when I've done some introduction, Fiona's going to tell her story. We thought that best.
So you're going to speak first?
I am.
Yes,
yeah,
lovely.
Okay.
All right. So if you, both of you could just say who you are, and then perhaps, Mary, you'd like to start.
Yeah. I'm Mary McLaughlin. I'm a mesh injured woman. And I've had a full removal of my mesh, and I'm founder of Mesh Ireland. I'm based in Belfast.
And I'm Fiona Bicknell, and I am mesh injured ×2, and I'm not actually a member of any group, but since meeting up with Mary, I'm an honorary Mesh Ireland member.
Right, thank you very much indeed. Mary, some of us of a certain age are slightly deaf, so if you could speak up a bit, it would be very helpful.
Surely. Yes, so Mesh Ireland started off as a one-woman campaign in the form of myself. I became injured, I was sick and realised I was mesh injured, and I started contacting public bodies in Northern Ireland and politicians and anybody I thought would listen to me to try and find out how I could access public services. So the Mesh Ireland campaign is more about the access to public services for women injured by mesh, and whilst we support the ban on mesh, it isn't the focus of the campaign that I have led. I am a lady with a trans-obturator tape. Trans-obturator tapes have been used more in Northern Ireland than they have in England. I can give you a figure from the recent audit, the ASH audit from 2018, and they said that 55% of women had trans-obturator tapes in that audit. I'm not endorsing the findings of the audit, but it's an objective figure from a scientific research paper. So it started as a one-woman campaign, and I found my first problem was that I had read from the Scottish campaign. I went on their website, informed myself there, but I discovered that I could have a mesh injury from a YouTube video on Harvard Medical site, and I wasn't sure where to take it from there, but I did go to my GP and I wrote him a one-line letter: "Dear doctor, I want my mesh implant completely removed." And then I give an appendix of why. And I found that was the starting point of my difficulty, because I wanted a full removal of the mesh, because I had read the risk of the implant had gone from low risk to high risk, and I didn't see why I should have to keep this implant in my body at all. So it progressed from there. I did join nearly every Facebook group there was, and promptly came off them after a couple of weeks because I just found it too much information at times. I wrote to the commissioning public bodies in Northern Ireland and asked why there were no services for full removal commissioned. And that was, my understanding was that there is a cohort of patients, and the number for a cohort is 3, and that when 3 patients or more present with problems and there are no existing services in the system, then a sub-commissioning group has to spring up and address those problems. And I couldn't understand why I would be a unicorn when other countries in the world, America, led, I think, with litigation and things like that. So I couldn't figure that out, why we didn't have commissioning of services. And I did talk to the Public Health Agency and the bodies in Northern Ireland, and they suggested I go down the extra contractual route, because it became apparent that the Northern Ireland system did not have surgeons who could remove trans-obturator tapes. So that took me, and it took several months and a lot of paperwork. It took me in mid 2017, I was referred to the University College of London. on BBC Northern Ireland and had expressed concern that women in Northern Ireland didn't have good services for mesh injury, which alarmed me as well. I went to London and I had five visits to London for my surgery, and my understanding was that I was going to have a full transobturator mesh removal. And in the meantime, I'd started my own Facebook group, mainly because I couldn't talk to a public body if I didn't have a Facebook group. But my Facebook group was mainly full of information, and I kept women updated on my journey in the hope that I could tell them how to get there more quickly or what to do, who to speak to, so it was informational. And we've women from the north and the south on our side, with the idea that if we got services in the north, we have cross-border arrangements that maybe one side could benefit from the other, or one public health authority could buy something and the others share it. And because a lot of women were going to England, and I found this journey to England I don't think it's desirable if it doesn't have to be. I couldn't understand why we didn't have full mesh removal services. So to get to the point of this is when I got to the end of my London journey, I did an informed consent procedure, and I was not assured by the conversation that I was going to get a full transobturator mesh removal, because I'd seen a doctor in America put up a video that you have to do a groin incision to remove the mesh, and that was not being offered in London. And I did correspond with London, and I shared some of that correspondence with the panel. And in the end, London said that they did a full vaginal mesh removal, that they did not take the pieces out of the transobturator nerve. So I was disappointed and frustrated that I'd spent a year repeating invasive diagnostics to then get to the end of the story to find that had I not questioned that informed consent process, that I may have ended up with a partial removal that I felt was a full. So I was here in September, the day after that appointment with Mrs. Henderson, and we talked to the panel in private. And I also put forward to you the offer of Dr. to come to the UK, and you expressed your concerns about some issues, and also suggested that maybe a training programme for surgeons on pro bono might be a good way to start something like that happening. So I went back to Dr. He was agreeable to that in principle, and I informed the review team of that. I informed the Permanent Secretary for Health in Northern Ireland, informed the Taoiseach, I informed the Scottish governments and the Welsh governments. And the general line that I found in the correspondence was that after due consideration, the UK, on all those things, felt that they had enough expertise here in the UK to manage without any international help. And that became the point where I asked for a transfer to America to this surgeon, and it was refused both by London and by Northern Ireland, and the suggestion was I could have an appointment with my mesh clinic in Belfast. So I felt as if I'd got to number 99 on the snakes and ladders and had just rolled back down to number 2. It seemed to be I had no choice. At that point I was bedridden. I didn't see this ending well if I didn't get the entire mesh out, and I travelled with Mrs. Henderson. We both decided that was our plan B if we couldn't get the surgeon to the UK, that we would go out and have the surgery. So we were both operated on. Mrs. Henderson allowed me to talk about her as well. We both went out and were operated, and we both had our meshes taken out. My mesh was 28 centimetres long. London was promising me my expectation should be 10 to 12 centimetres. I had a 28 centimetre mesh taken out. My mesh had been inserted into my bladder when I had it put in, and the surgeon found a hole in my bladder. My bladder had been perforated despite having 2 cystoscopies before I went to America. Nobody had found the perforation. Mesh was in the urethral wall, and I have had, my mobility has improved enormously. It's beyond all expectation how well I can walk and sit. I think I told you I couldn't sit. That pain went from the next day. I thought it was the morphine, and it's gone. It's gone. I can walk without pain. My muscles are weak, but I can walk without pain. I can drive without pain. I can sit without pain. I bought a Fitbit. I'm sleeping 8 hours. 8 hours, 4 hours deep sleep, 4 hours normal sleep. I'm not on any pain medication. I haven't had an infection since I came back. I had other repairs, which I don't want to talk about. But this transobturator mesh is very, very debilitating. And we'll get to the partial removals now, and why women don't want partial removals, and why the women on my group that have partial removals, they are on the scrap heap. Not a single surgeon wants to offer them the removal of the remainder of their mesh. They're being sent to pain management and told nobody wants to touch them. And I fear for every woman in the world, apart from every woman in Ireland or Northern Ireland, Scotland, England or Wales, that has these partial removals, and our surgeons don't want to go near them. So maybe at that point, Fiona, you could tell your story.
I mean, I did submit my story to the review, so there's obviously a lot more information on there that I don't know, make good bedtime reading, I suppose. I'm Fiona, and I'm 44, and I've got 3 children and 1 granddaughter who was born in the middle of my mesh nightmare. In 2009, I had a anterior prolapse mesh kit fitted for cystocele, and at the time I was told, minimally invasive, it'll solve all your problems really quick, no problem. And to be fair, I had a wonderful recovery. It did what it said on the tin, and I was actually very happy, and life went on. And then in 2014 I had a sling fitted for stress urinary incontinence, which was mild. It was irritating, but it wasn't terrible or anything. And again, I was told, this will sort the problem out, it'll be fine. So I went ahead and had that done, and then roll on to September 2017, I had a subtotal hysterectomy done laparoscopically due to fibroids and heavy bleeding. And about 8 weeks after recovering from that, I became aware of the horrible sort of heavy dragging prolapse sensation again. I was experiencing a lot of pain during intimacy with my husband. I was feeling like I'd been kicked really hard between the legs. That's the only way I can describe it. And I had this intense urethral burning, just really bad burning. And I just thought, gosh, what is going on? So I went back to the consultant who did my hysterectomy, who is also the same consultant that fitted my bladder sling. And over the next 6 months or so, I had MRI, I had cystoscopies, I had examinations under anaesthetic, I had pain injections vaginally, I had numerous exams with him, and every single one came back, you're fine, everything's fine, I don't know what the problem is. And I said to him, look, I'm not a hysterical, irrational person. I'm telling you there's something significantly wrong with me. I'm not making this up. The pain is really bad. And he was amazing. He did listen. He never doubted what I was saying to him. And in the end, he suggested that the vaginal pain I was experiencing was a certain area of the prolapse mesh that I'd had fitted. And he said, well, I can't help you with that because I've never fitted prolapse meshes, so I'm going to have to refer you to somebody who can help. And with that, we went through, there was a list that they all have for specialist mesh centres. And he recommended that I go to Croydon and see if she could help me with my problems. So I got an appointment to go and see her, but in between me going to see her, my pain got progressively worse to the point where I couldn't walk from one side of my house to the other. And I was changing my daughter's bed one day, and I had the most horrific It was like somebody had got some hot glass and was literally slicing my insides. And it was so bad that I actually fell to the floor, terrified my poor children. And when I went to stand up, I couldn't walk. I'd lost all use of my left leg. So I was absolutely petrified, and I just thought, gosh, what's happening to me? I just had no idea what was going on. So we called an ambulance. I was taken to my local hospital, where my lovely consultant found me, and sort of, they dished out morphine and everything, and he said, right, we just need to keep you comfortable and get you to Croydon so we can find out what's going on. So I went, had the translabial scan, and it was apparent straight away that the prolapse mesh had basically concertinaed up one side. So one side had come away from where it should be positioned and was all kind of bunched up like this under my bladder. And she said to me, no wonder you're in so much pain. So that'll be the reason why you're suffering. So we then had the conversation. She said, yes, I can take it out. And I said, can you remove it fully? Because obviously by now I'd done an awful lot of research on mesh, and I understood that, this whole partial scenario was not a good outcome for women. And she said, yeah, it's all going to come out. So I was just like, oh my God. So I had my surgery and it was removed. It went well. I had a horrific experience at the hospital which left me with PTSD, but that's another story. It was extremely traumatic. Anyway, she came and saw me and said yes, it had gone well, etc. So I went through the very long process of recovery. Oh, and I did say to her, is my sling okay? And on the translabial scan, it showed that my bladder sling was actually perfectly positioned and there was no concern. And when she'd removed the prolapse mesh, it had slightly eroded vaginally, but she'd oversewn it. So straight away I'm thinking, oh God, this is not good, because I know the moment they start to erode, you're on a highway to hell, really. Anyway, so I recovered, but as I was recovering, I was still in an awful lot of pain and I was not right, and I just knew something was wrong. So at this point I started following a doctor on Twitter, who was very open about his removal surgeries, how it's done, how big the average mesh is, depending on what kit's used, etc. So I educated myself. And I actually spoke to him privately over Twitter, and I said to him, I've had vaginal surgery to remove this mesh. And he said, you've had a partial, basically. He said, the only way to fully remove the mesh you had was by vaginal and groin incisions. And I was devastated, because I honestly thought the whole thing had come out, and this is what I'd been told. So when my husband and I went back to see my consultant for my follow-up, we asked again, and I said, has it all been removed? And she said, yes, it's all been removed. And my husband said, well, absolutely all of it. And she said, well, as much as we could get. So I was just heartbroken, because I knew I was still in pain. My pain hadn't improved. I was still, in a terrible way. I couldn't have intimacy with my husband. And at that point, I just thought, right, well, what do I do now? I've got to do something. And I've totally lost trust in the UK surgeons. I mean, this is a specialist mesh centre. And I said to her, look, I'm still in pain. And she said, well, we can refer you to pain management. And I said, that's not really acceptable, because I didn't have pain management before I was fitted with mesh, so why is it deemed acceptable now? I shouldn't live the rest of my life in pain like this. It's not fair. And I said, and also, I'm very worried about my bladder sling. And she said, well, are you continent? And I said, yes, I am continent. She said, well, what's your problem then? And at that point, I just thought, well, there's not really a lot of point in me kind of really saying much more. I just knew it was a closed door. And she looked at me and said, I don't know why you're looking at all the hype. She said, you don't need to listen to all the hype. She said, most of it's nonsense. And I mean, this was a mesh injured woman that she had operated on, and she told me to ignore the hype, bearing in mind that this hype, I've experienced every aspect of it. So we just kind of, my husband and I, we just thought, right, well, we'll leave it, and walked away. And then I went home and cried a lot. And my husband said, right, well, what are we going to do to get you fixed? So I spoke to, and I said, I can see you prove that you fully removed these things. He's got great results. He's done over 2,500 operations. He really knows what he's doing. So we flew to America. and that's what happened in January, and that's how I met Mary and Iris. And he went in through my groin, and he went in vaginally, and he went in abdominally, and he got removed my entire bladder sling, all 24 centimetres of it, and the remainder of my prolapse mesh, which was a significant chunk. And it's all gone, and I received the most amazing care, and he also sorted out the prolapse, and he also said that he was upset for me at the state that I'd been left vaginally, and in his words, he took a dirt road and made it into an asphalt road, which was nice of him, but so yeah, it was amazing, great care. I'm now completely and totally mesh free, and when I came back I emailed my lovely consultant, the one who fitted my bladder sling, and I explained to him that despite the translabial scan saying my bladder sling was fine, it was actually embedded in my bladder wall and it was eroding vaginally, and that at some point it would have worked its way into my bladder. And he was really, really devastated for me and said that he was extremely sad. He was more than sad that I'd had to go to America to get the results that I needed. And it was him himself actually who spoke to me before I went to America and told me that my best bet was to go and see him. This is a senior urogynecologist. He's the lead in my local trust, and that he told me, you're better off going to America, because he felt terrible. He'd sent me to a specialist mesh centre and they left me worse off. Finding fragments of mesh or portions of mesh is really difficult. I mean, even me, I can't guarantee that I'll find it, because once you remove that vaginal section, it's like finding a needle in a haystack. You know, you don't have a point of reference to follow where the rest of it sits. But he did find it, and the whole operation was videoed, and I've got, you know, all the pictures. I can see exactly what happened to me, what was removed. That's the best thing I ever could have done. I mean, my life is never going to be the same. You know, I'm not ever going to be able to lift anything. My granddaughter, you know, she only arrived last March. I can't hold her, I can't pick her up, and I can't even begin to tell you how hard that is for me. I'm not going to get emotional. I had for a number of months moments where I was suicidal, and my husband had me on suicide watch because I had no idea what was happening to me. I just had the most horrific pain, and everything was coming back, you're fine, we can't find what's wrong with you. And I'm very fit and active. I horse ride, I walk my dogs, you know, I'm an outdoor girl, I'm a farmer's daughter, you know, I love all of that. I don't have that. I had lost all of that. I don't know if I'm ever going to be able to go back to that. And that's what mesh has done. And I have nothing against my implanting surgeons. I genuinely believe they thought they were helping me when they fitted me with this stuff. But what I have a problem with is that you can put this stuff in, but you can't take it out. And it's causing catastrophic damage. And there's just more and more and more and more women now that are suffering. It's, you know, it's just not acceptable. And this is 9 years and 5 years post-implant that this happened to me.
Fiona, I'm so sorry. I'm so sorry. Are you in any pain now as a consequence of all this?
I've had just the usual post-surgery discomfort, and occasionally I get a bit of grumbling from nerves in my thigh, but you know, I had that after my partial and that did settle down. I think it's quite invasive surgery, so it takes a while to recover. Yeah. I'm only 10 weeks post-op, but I feel great. Mm-hmm. And I flew 2,500 miles, 9 days post-surgery, with a groin full of stitches, a stomach full of stitches, and sitting on a hedgehog, and it was actually fine. Yeah, it was, you know, and this is how the level of care he gives. His expertise in surgery is so good that I was up and walking to the gift shop the day after my surgery in America. I couldn't have even walked to the toilet when I was in the UK hospital. That's got to tell you something.
And can I ask, because I understand a lot of your members have gone to America, who pays for that?
We did. We haven't carried any debt for about 10 years, and we had used our emergency savings and credit cards to pay for my surgery. And yeah, we couldn't afford it, but my husband said, you know, my health is more important than anything, and you know, my children needed their mother back, and you know, I can't be intimate, you know, with a man that I've loved for 16 years, and he's amazing. He's never given me a hard time over it, but you know, when you really love someone and you've got a real partnership, it's hard. So but I'll be swinging from the chandeliers again, hopefully now.
Can I then just go back to your organisation? Can I ask you, Mary, how big is it? How many members do you have?
We have roughly 100 members, about 94, 95. Some come, some go. So usually just under 100 members.
And it covers Northern Ireland and Southern Ireland.
And Southern Ireland, yes. And the situation at the minute is, and I'm conscious of the time, the women going to their consultants need to be clear that partial removals can be named under different names. And people need to be aware, if my tape was 28 centimetres and you have a tape, people are saying they've had a full removal and there's been 8 centimetres of tape taken out or 6 centimetres of tape taken out. And the doctors, up until very, very recently, were saying this was due to shrinkage. And that was what I was being told, that I should expect 8 to 12 centimetres because it shrinks. Now my tape was 28 centimetres, and I was a slim woman that when I had the tape put in. So if my tape had shrunk down to 28 centimetres, it doesn't make sense. It just doesn't make sense. So there are people, I watch on Facebook groups and I hear on Facebook groups of people saying they're going in to get a full removal and come out and say, I'm great, I'm mesh free. There was a removal of 8 centimetres. Those women are getting partial removals. And when I look at the language that's used, it's a full urethral removal, a full vaginal removal, a full removal vaginal, a full removal of vaginal mesh. Now most women talk about their entire product as a vaginal mesh. So the surgeons are now creating this it's trickery. There's no other word for it. It is trickery. They know, as we would say in Northern Ireland fine rightly, that the women think when they say they're getting a full removal that all the mesh is coming out. And we keep telling women that it is impossible to take this transobturator tape out without doing a groin section. And surgeons are telling women, myself included, that they can take it out vaginally without doing this groin section. And
it's just not possible.
It's not possible. And the women, once the tape is cut, it's cut. When the patients go back to them, they are told that they misunderstood. And that was the line I have. I misunderstood nothing. I made a tape recording of that informed consent. And I've listened to it again. I did not misunderstand anything. What chance do our women in the UK have if they have to tape record every intervention with their surgeons? Where is the trust? And why, at this point of the mesh campaigning, the Scottish people have been campaigning for 7 years, why at this stage when the review is running, why do I still have women thinking that if they get a tiny section of a transobturator tape out, that they have a full removal? It's because they want to believe their surgeons. And if there's anything I can do here, is to say that the review team have a massive responsibility to stop surgeons doing this now. They have to improve their informed consent forms. They have to have it printed out and not handwritten. They have to have boxes saying, I intend to do a full vaginal removal, a full urethral removal, a full transobturator removal. I expect to get this length of tape. We know that it's not always possible, but it's happening. And the translabial scan, Northern Ireland, I worked with Orlia Flynn from Sinn Féin. She's the chair of the All-Party Mesh Group in Northern Ireland. And she worked very hard with our permanent secretary And my inside track is that the mesh appointments for translabial scans start next week. Okay, so we've got this scanner, and originally we thought it was so that people could see what type of tape they have in because their records are not complete. That problem remains. But now it's all the women with partial removals. They want to come back now to see, because they were told it was nearly all out, or it was all out and it shrunk. And now they're seeing people like myself coming back with 28 centimetres of tape. And they're saying, well, I only got 4 centimetres out, 6 centimetres. Is this why I'm still in pain?
Do you mind if I just say, just very quickly,
certainly.
You asked about the costs, but a friend of mine had paid privately in London with a London consultant to have her tape removed, transobturator, and was told it was a full removal. But then realised that she was still in pain and couldn't understand why, but she was adamant that this surgeon had removed it all, and she's just been down to see another consultant who went in through the groin and removed another 13.5 centimetres. And you've got another person that I know who's been quoted £27,000.
So how much?
£27,000 to have a rectopexy mesh removed, but that's only partial surgery, that's only one surgery. Chances are they'll end up with some kind of bag or ostomy of some sort. £27,000. I went all the way to America with my husband and I had surgery for full removal in one hit with no scans, no tests, no nothing, for a lot less than that. So that's something else that, in my opinion, it's wrong. It's so wrong.
I think perhaps I'll just ask, because we're having to move on a bit. Any
Just
questions?
a quick question. You said that there was a surgeon that was doing removal via the groin. Is that surgeon offering a full removal?
The only surgeon I could guarantee can remove fully was Dr. But the other surgeon, I understand, is now doing full removals. Yeah, with the help of a plastic surgeon.
May I say something to that? I've clarified this. The plastic surgeons are brought in for after the mesh surgeon goes in. So the mesh surgeon goes in, and when they cannot find the mesh, they cut through good muscle. Okay, and then the plastic surgeons are brought in afterwards to reconnect the muscle. And on the mesh grapevine, there is word that this has been unsuccessful in a few women already, and one of them was in a magazine, and she's fully paralysed from the waist down because the muscle reconnection was not possible. He does a tissue sparing, muscle sparing, so he does not cut the muscle in the leg. And a lot of women are now being told, you can't get that removed, you're going to die, it's too difficult, it's too risky. And the question is it the surgical technique that's being used has a high risk? And is it fair to now frighten women who've got this bit left in their transobturator nerves, to frighten them into becoming bedridden? And I was up in Scotland talking with the Scottish mesh survivors last week. And there were women who said they were like me, that they were bedridden. They're now in wheelchairs. They're in wheelchairs. It's unnecessary. It's not fair. I mean, people live to a good ripe age. If you're in your late 40s, early 50s and already in a wheelchair because of mesh in your transobturator groin, and the UK has slept on the job, why should the women not get these surgeries that can bring their life back up to where it should be, or something positive?
Thank you very much. Simon, have you got any questions?
Well, again, thank you both for what you've told us. I think it's incredibly powerful, and you've said it so eloquently, and it's brave for you both to do that, so thank you. I suppose the one question I've got, which you've sort of touched on maybe already, is what do you think we need to focus on the most in terms of trying to help recommend things that will improve the position for women that you've talked about?
You need to get the UK surgeons up to speed really with full removals. I think that should be your main focus really, because there are hundreds and hundreds of us now that are mesh injured, and there isn't the skill in the UK to safely and fully remove these things. Admittedly, people like are doing an amazing job in trying to move forward to help people with full removals, but ultimately he didn't have that skill set, so that you're still going to have a number of women that have ultimately been guinea pigs whilst he's honing his skills. And that's no criticism of him, because I believe he's doing an amazing job and he's working really hard to help, but you've got an awful lot of surgeons that can put this stuff in, but when you have a problem they're kind of like, well, sorry, we haven't got a clue, wouldn't even know where to start. So I think that's, you need to get people listening, and you need people to accept that this is a big problem, and that partial removals are actually worse.
Women are stopping going to their doctors. That's my women are stopping because they know the surgeons don't have the skills. They feel like they've been the guinea pigs for have-a-go surgeons previously, and now the mesh injured are going to be the learning curve for people trying to take transobturator mesh out of their bodies, and they could be left paralysed.
I mean, how would I in a million years suggest to another mesh injured lady to go to a mesh specialist centre when I received the treatment that I did, that potentially could have left me in a really bad way? If doctors hadn't been able to find the remainder of that mesh, I have no faith in the UK at all, no faith, and there's an awful lot of us that don't. And if I ever have to have further surgery, I'm going back to America. I'm not stepping foot in another UK hospital. It's shocking, it really is shocking, and they need to step up big time.
So,
thank you very much for coming and talking to us. We've met before, and it's very important that we hear this. Mary, can you talk a little bit more about what you think a consent procedure needs to be to create trust? Because you mentioned the importance of trust, which is vitally important. And you mentioned the notion of recording the conversation, and that seems to me to be, and to us generally, to be a very good idea, because you can go away and think about it, talk to your relatives, and then go back some other questions. But what else would you want to see in the consent procedure?
I think that the consent procedure is slightly problematic because of the way it's structured. The consent procedure is usually at the end of an appointment, and it's often it's like at school when you teach and you're trying to pack something in the last 10 minutes, and the consent is often rushed. The notion of handwritten consent forms, and I brought mine with me, which I'm happy to share with you, and I'm happy to share that tape recording privately with you, that you can listen to it yourselves. There has to be some type of control within some type of regulation of how this type of consent is performed. If we know how long a piece of mesh is, in general, an average length, a surgeon must be able to put his best work in front of a patient, a picture. I know there's data issues, but they can be overcome. A picture of a mesh is not as intimate as a picture of somebody's body parts. There has to be a picture that the person can visualize what that is. Despite all the information I put up on my sites, some women still aren't very sure of what it is actually the surgeons are doing. There has to be that picture, there has to be an average length, there has to be a confirmation on the sheet that the doctor has signed that he has told a patient that he can take it all out, or he or she can take partial out, and then a percentage of what their best achievement is, best, average, medium. You can give some statistics that people can say, okay, with this doctor, he has a good track record. I know that it gets 75% of the mesh out. He usually gets that out. People understand everybody's individual. There also has to be some type of control over what the doctors are stating, and I don't understand the process of revalidation. I have checked all the doctors in Northern Ireland and in Ireland as I can whether they've been revalidated. And I question how a lot of these surgeons have been revalidated, and I question the process of it. Are they only doing 2 surgeries a year or 2 surgeries a month? There has to be a quantification. The empirical data has to start, that the patient can see the empirical data, can see if this is a starter, if it's not a starter. The consent form has this thing on it, I know this is a training hospital and therefore I'm happy for somebody else. Well, even I feel a bit awkward to say, no, score that through, I want that doctor. And I was given the team narrative. I was told when I started my journey that UCLH would be doing my surgery. I was told that from the manager of the hospital when I phoned up. I said, I'm quite happy to have diagnostics for the team, I understand that, but the surgery is... I said, oh yes, only operates. That's what I was told. And when I got to after a year of all this, I was told we operate as a team. And I've read on Facebook where somebody said, oh, Dr. S did the right-hand side, Dr. such and such did the left-hand side, and the consultant came in and finished the work. And I just think, is that the best we're going to do for the mesh-injured women? Because that is a training exercise. And people have been waiting so long on these appointments when we get to the informed consent. They're so vulnerable and grateful for everything they've got. They just don't want to seem like an awkward customer and say, no, I have to have only that one surgeon doing it. So it's too loose. The whole process is too loose. And we need, if we're going to do empirical data from all other things, then the patients need the empirical data, and we need to know adverse events. And we have one woman in our group who died, and she was operated in 1998 and she developed squamous cell carcinoma, and she lived when they thought she was going to die, and she lived for almost another 10 years, and she died last January. And she developed squamous cell carcinoma, and that is from the friction of the eroded mesh onto the flesh, and that's the trigger. I'm not good at medicine. That is the trigger for that type of cancer.
Mary, I'm afraid I have to draw this to a close now.
Thank you, that's fine.
But I want to reiterate what my colleagues have said. Thank you both so much for coming, because I know it takes a lot of courage to actually explain all this that's happened. It's such a very personal thing.
Thank you for all you're doing.
Yes,
We do appreciate it. Thank you so much.